The morning of the surgery began like any other hospital day, quiet but heavy with expectation. Daniel's family arrived early, carrying the fragile hope that this procedure would finally end months of pain and uncertainty. Daniel was 46 years old, a warehouse supervisor, a father of two, and the kind of man who rarely complained. For nearly a year he had lived with worsening abdominal pain, nausea, and unexplained weight loss. After multiple visits and scans, doctors concluded that he needed surgery. They assured him it was routine, low risk, and necessary. The surgeon explained everything quickly, confidently, using words that sounded safe and familiar. Daniel signed the consent forms without fear. He trusted the system. He trusted the man in the white coat. Inside the operating room, bright lights flooded the sterile space. Nurses moved efficiently, monitors beeped softly, and the surgeon reviewed the chart one last time. What no one noticed in that moment was a critical error already written into the file. Daniel's diagnostic images had been mislabeled. A small but vital detail, left versus right, had been entered incorrectly during an earlier shift change. It was the kind of mistake that seemed harmless on paper but catastrophic in reality. The surgeon, relying on the chart instead of re-verifying the images, prepared to operate on the wrong side. The surgery lasted longer than expected. Complications arose, but the team managed them and closed the incision. When Daniel was moved to recovery, the surgeon told the family that everything had gone well. He mentioned minor difficulties but reassured them there was nothing to worry about. Daniel remained unconscious longer than usual, but staff explained this was normal. His wife, Maria, sat by his bed for hours, watching his chest rise and fall, believing the hardest part was over. When Daniel finally woke, something was wrong. The pain was unbearable, far worse than before surgery. He struggled to speak, his voice weak and confused. Nurses adjusted medication, assuming this was standard post-operative discomfort. But by the next morning, his condition deteriorated rapidly. He developed a high fever, his blood pressure dropped, and alarms echoed through the ward. Doctors rushed in and ordered emergency scans. The images revealed a horrifying truth. The surgery had been performed on the wrong organ. The healthy side had been damaged, while the actual problem remained untouched. Worse still, internal bleeding and infection had already begun to spread. The medical team scrambled to stabilize Daniel, rushing him back into surgery to correct the mistake. This time, there was no calm explanation for the family, only rushed words and tense faces. The second surgery saved Daniel's life, but it left him permanently changed. He spent weeks in intensive care, drifting in and out of consciousness, connected to machines that breathed and fed for him. Infections followed, then organ failure that took months to control. When he was finally discharged, he was not the same man who had walked into the hospital. He could no longer work. Chronic pain became his constant companion. Simple tasks exhausted him. His children were afraid to hug him too tightly. His life had been split into two parts, before the surgery and after it. At first, the hospital maintained silence. Doctors avoided direct answers, speaking in vague terms about unexpected complications. Medical records were slow to arrive. Requests for explanations were redirected. Maria felt something was being hidden. As bills piled up and Daniel's condition failed to improve, frustration turned into suspicion. A nurse, speaking quietly one evening, finally said the words no one else would: "You should talk to a lawyer." Hiring a medical malpractice attorney was not easy. The family had never imagined suing a hospital. They were ordinary people, not litigious by nature. But desperation pushed them forward. The lawyer requested full records, imaging files, internal reports, and staff schedules. What emerged over the following months was a clear pattern of negligence. The mislabeled scan. The lack of verification before surgery. The failure to disclose the error immediately. Expert reviewers confirmed that the mistake was entirely preventable. As the case moved toward court, the hospital's tone changed. Where there had once been silence, there were now offers of settlement. The first amount sounded large to the family, but the lawyer advised against accepting it. Daniel's future medical care alone would cost millions. His loss of income, his permanent disability, and the emotional trauma to his family had to be considered. Maria agreed to keep fighting, even though the process was exhausting. The trial lasted 3 weeks. In the courtroom, the surgeon testified that he had followed standard procedure. The hospital argued that complications are an accepted risk of surgery. But under cross-examination, inconsistencies appeared. Charts didn't match testimony. Timelines shifted. A radiology technician admitted the labeling error. Another staff member confirmed that no surgical timeout verification had been properly conducted. Expert witnesses explained, in plain language, how a single pause before the incision would have prevented everything. Daniel testified on the final day. Walking slowly to the stand, supported by a cane, he spoke about the life he lost. He described waking up in pain, unable to understand what had happened. He talked about missing his daughter's graduation, about watching his wife work 2 jobs to cover expenses, about the humiliation of needing help with basic tasks. His voice broke, but he did not look away from the jury. When the verdict was read, the courtroom fell silent. The jury found the hospital and surgeon liable for medical negligence. They awarded Daniel and his family $3.2 million in compensation. The amount covered past and future medical care, lost income, and non-economic damages for pain and suffering. Maria cried, not from joy, but from relief. The money could never undo the damage, but it meant security. It meant acknowledgement. It meant the truth had finally been spoken aloud. After the case, the hospital issued a public statement expressing regret. They announced new safety protocols and mandatory verification procedures. For Daniel's family, those words came too late, but they hoped no one else would endure the same ordeal. Their story spread quietly through legal circles, becoming an example of how small errors can destroy lives, and how persistence can still bring justice. Daniel still lives with pain. Some mornings are better than others. He attends physical therapy, manages medications, and focuses on small victories: a walk around the block, a family dinner, a laugh with his children. The compensation allows him to focus on healing rather than survival. And though the scar across his body will never fade, it stands as a reminder of the cost of negligence, and the power of standing up when the system fails. This story is not unique. It happens in hospitals every day, often without headlines or courtrooms. But when one family chooses not to stay silent, when they demand answers and accountability, change becomes possible. Daniel's case is a warning, a lesson, and a testament to the fact that trust in medicine must always be matched with responsibility.